Missed you last week, Brian.
I forget, where was I? I can't remember. Oh, geez. I got so many things going on that at times you can't keep up with yourself, if you know what I mean.
Oh, yeah.
You know, and loving every minute of it. It keeps you busy. But, oh, great fun.
Yep.
Yeah, I know what happened. At all intents and purposes of being on the call, and about 8:30, I said, I'm going to take a snooze for an hour. And I said to my wife, make sure I'm up. I woke up at 10 after 11 and she was snoring away right beside me. Oh, there you go.
Oh,
anyway, yeah. Great fun.
Yep. Well, it looks like our buddy Dave Nelson's on.
Finally coming alive. Hey, Dave. Oh, he doesn't want to talk to us now.
Yeah.
Yeah.
So, Brian, do you know what a shoe cobbler is?
Yes, I do.
I just picked up a little job doing that part-time.
Oh my goodness, people. That was Chariots of Fire for David Nelson.
Hello, Mother.
For our rock star.
Hi, Dana.
Hi, everyone.
Hello.
Welcome, welcome. This is going to be so much fun tonight because I tell you, we are on fire. Yeah, we are on fire. There's going to be so many exciting things happening, and I am so honored and privileged this evening to have Dr. David Nelson and Dr. Joe Ahrens on our call. And we are going to have some great banter with the scientists and the incredible naturopaths of the world. And you're going to, you know, join in too, because I know, Ron, you've got some great things you can contribute to. I want this call to be all about EMULIN and 24/7 and how it impacts lives and what it does. And this is recorded because I want you to have something that you can send out that's just short. We're going to do just a short half hour. So I know most of you know me, but my name is Jana Jorgensen, and I'm thrilled to be here with you because we are such fans of EMULIN and Dr. Ahrens' products, and we have to really, really get this rolling. And I've been talking to a few of the leaders today to get some ideas going about what we're going to do. And I think you're going to be very excited with the plan that we have. And we haven't put it in place yet. We're going to get some approval on it. But if we can get that approval, it's going to make the end of this year for you and the first quarter of 2020 magnificent. And that's my goal, so that you can all benefit because of your patience and what you've been going through this past year, waiting for EMULIN to be in plentiful supply. So that is the goal. I've been working very hard on this, and I'm so excited. So with that, Dr. David Nelson, are you there on the video, or are you just hiding behind that? Are you on the phone? Do we have him? Oh, I have to unmute him maybe. Okay, there we go.
Yeah.
I'll
be on the video. I'm here.
Oh, good. We need you. You're the man. I played that song for you, Chariots of Fire, Mr.
Okay.
So I want to, you know what, before Dr. Ahrens gets on, if you wouldn't mind starting out, Dave, and let's just treat this like everyone is a guest on this call, because I want this to be a valuable resource, you know, for our people. And if you wouldn't mind doing that and explaining, you know, when you came on board with EMULIN, what you saw when you heard about this product before you even tried it, what it meant to you, what you know about this, in terms of science and with your profession, and then we'll take it from there.
Well, EMULIN. I've been involved with EMULIN, been using it for 3.5 years now, and it's a combination of 3 ingredients: quercetin, myricetin, and chologenic acid. These 3 components are the most powerful ingredients put together by Dr. Joe Ahrens in helping in inflammatory conditions, in helping with controlling blood sugar. Each one of these 3 components individually are powerful as anti-inflammatories, but they are what we call flavonoids in the nutritional field. They're flavonoids, polyphenols, and these are extremely effective in helping control sugars, inflammation, and myricetin has its own properties very similar. Hyaluronic acid is also from green tea extract, and that component is so powerful in the area of helping support the liver and helping to support food cravings, helping to support fat metabolism in the liver, and it also has amazing property in helping the skin in the area of it helps so that you don't burn. It's powerful, and each one of these 3 components together, what Dr. Ahrens and Gerald Thompson have put together, is powerful, and that's why they did the double-blind study on the clinical study and showed that it helps in controlling sugars and helping to manage sugars, chaperone sugars in the blood, so it takes the sugar directly to the muscle to be used as energy. And so that is such a critical piece. I like what Joe says. Sugar is our biggest issue, and that most people have problems with across the world. And too much sugar, 200 pounds of sugar or more consumed every year. In 1905, 1910, the average sugar consumption was close to 5 pounds of sugar. Now we're looking at 200 pounds of sugar. Imagine carrying 200 pounds of sugar on your back. 200 pounds, that's a lot of sugar. Most people in the world, or North America, I should say, are consuming every year. What that does to the liver, the spleen, and in depressing the immune system, you can't even put words to it. And one of the things we found that the sugar that Joe Ahrens has talked, Dr. Ahrens has talked about. I love the little diagram and scenario he brings up, that sugar creates an inflammatory condition in the arteries, and that inflammatory condition, the body sees that inflammatory condition, and it sends its healing nutrients like fibrin, like calcium, like cholesterol to help heal that. And when this complex, sugar complex, continuously infiltrates the arteries and causes injury, the body is always trying to heal that. It's always in the process of healing. It sends its nutrients. So this builds up and builds up, and the end result of that healing is like a scab on the inside of your artery walls, and the medical system calls that plaque. And that builds up and builds up and builds up. Well, we have something in EMULIN that actually helps to heal that injury, to take that sugar out of the bloodstream to go and be used as energy. It's powerful. We have something in our hands that I can't even put words to it. It's so powerful that everyone needs, from birth to seniors, need EMULIN every day, because these complexes, these polyphenols, are powerful antioxidants. we're not getting our food unless you're eating pounds and pounds and pounds of vegetables and fruits, which most people in North America are not doing. They're eating pounds and pounds and pounds of sugar.
Amazing, Dave. And I know, you're just one of the most incredible fans of EMULIN, and your patients in your office have, benefited from EMULIN now for years. And,
Yes.
and that's just, how do you feel the medical community especially in, the alternative health with holistic practitioners and naturopaths? I mean, do you think they all should be recommending this for their patients?
Every one of them. If they know, the docs that I know right now that I've been talking to and have talked to about EMULIN, they're all enthused. They love what it does because it presents the body with something that normally foods don't do what this does. This allows, if you're eating good foods, but this allows the body to do its job. It doesn't heal anything. We're giving the body what is missing, and then the body takes that in the process of healing the way the body and God created it. So that's what we're giving the body. We're giving the body what it really needs to do its job. We're supplying the nutrients, we're supplying the mortar, we're supplying the hammer and nails and the mortar to help do its job in creating the restoration, the detox, the liver detox, the cleansing, the fat metabolism, and chaperoning those sugars that most people do not have ability to do because they're eating too much. And if you're eating 200 pounds of sugar a year, you're not getting enough vegetables and fruits, guaranteed, because you're eating too many carbs. And carbs create inflammation. All carbs create inflammation. All carbs break down physiologically to sugar molecule.
Amazing. Well, Dr. Nelson, Dr. Ahrens has just joined us, and he is one of your fans as well. He just thinks the world of you. And I know you two have worked together on different projects. And so, Dr. Ahrens, could you just share with us why people need to stay on EMULIN, why they need it in the first place, and why they need to stay on it, and what happens to them when they go off it? Because we've had a lot of people think they could just take it for a short period of time, get well, and then move on. And that's not the case. So could you tell us why that happens?
Well, Dr. Nelson, you're still hammering away at everybody needs EMULIN, and I don't know if you're ever going to retire. I heard that doctors don't retire, they just run out of patients.
Yeah.
But you've been on the bandwagon for a while because you do understand that this is not a product that heals anything, although it appears to heal numerous conditions, arthritis and psoriasis and obesity and diabetes. It's actually vitamin-like in that we need this product, EMULIN, in order for us to be healthy. It's not something that you take to heal yourself. And yes, it's true. Let's say, for instance, if you've got a cold, you can take a extra dose of vitamin C, but actually you need vitamin C every day of your life in order for your immune system to operate properly. What we have discovered is a vitamin-like compound. I have to say vitamin-like because the rules, the laws say that we can no longer discover any new vitamins, unfortunately. We have discovered a new vitamin, but I have to call it vitamin-like. This product is essential for you to process carbohydrates and also for your immune system to function properly. If we had the proper diets, let's say, I don't know, 500 years ago, 1,000 years ago, EMULIN would already be in your diet and you would not need to take this supplement. But it's not there because of several reasons. One of them is it's been accidentally bred out of the food supply. Secondly, through most foods, it's processed out, it's filtered out. So you truly need to supplement your diet. It needs to be part of your diet. It is, in order for you to function, it is necessary. You need it every day. And this is very interesting because a lot of people come to me and say, well, I feel great. I don't need that product. I'm healthy, I'm active, I'm not overweight, I run, I bike, I cycle a lot. I said, look, just try the product. After a couple of weeks, they come back and say, wow, I felt like I just woke up out of a fog. I'm thinking more clearly. I'm sleeping better. I don't have the aches and pains that I thought were normal. And I'm getting less colds. It's because this is actually required for your immune system to function properly. This is not like some strange product we got out of a unique cactus in the middle of the Gobi Desert. This is stuff we're getting right out of food sources, and you should have had it all along in your diet, but it's not there. So who needs EMULIN? Just like Dave said, every single person, from babies, actually even in the womb. Pregnant women need it. Nursing mothers need it. The nursing babies need it. Adolescents need it. Mid-aged people, elderly, even like myself, an old guy like me. I need it. Athletes need it. Couch potatoes need it. Everybody needs EMULIN. So that's who your clients are. And if there's anyone on this call that has not had it before, get the product. You'll know what we're talking about. It's not a stimulant. It's nothing artificial. It's all natural. It's what should be in your food anyhow. You need to supplement your diet in order to be truly healthy.
There we are. That was so excellent. Thank you, Dr. Ahrens. Dave, do you have anything to share about that because you work with patients every day on a different level than we do? And
well, yes. I mean, one of the things I recommend EMULIN to everyone for the very reason Dr. Joe has mentioned. But I see a lot of chronic inflammation every day with itises that patients come in and have issues with. And itis is just an inflammatory, the inflammation raging in the body, and the medical system has put a name on it. So our goal, what we do, we look for the root cause. We look for what's causing this inflammation. And in most cases, it's deficiencies, poor diet, and guaranteed most of the patients we see, they're consuming too many carbs, too many sugars, and that sugar and carb is actually wasting the body of the components that EMULIN needs. That EMULIN is in the body. It's wasting that, and it's causing inflammation, which is creating more of a need for the EMULIN type product. So that's where I recommend for the patients that I see and the clients I see, for athletes I see a lot of professional athletes. I give them a higher dose of EMULIN initially to help in their inflammation, because they're working out, they're training at a high level, and they're creating muscle breakdown, and now we have to heal that muscle back again. So I'm increasing those flavonoids that are consisting of, that's what EMULIN is. And so we're getting great results when we increase the dose initially, and then we can start weaning the dose down. But that's what I'm seeing.
That's awesome. Tell us now, who are the individuals that would need a saturated dose, and what would that look like? Either Dr. Ahrens or Dr. Nelson.
Joe, do you want to go?
Yeah, I'll take that over. So, everybody needs it in their diet every day, and we have set the current dose at 500 milligrams, especially with this new formula, this new brand new one we put out, which is extremely concentrated, 500 milligrams every day for just daily needs. But if you have any issue at all, what does that mean? Well, aches and pains, arthritis, psoriasis, obesity, diabetes. If you think you have an issue at all that you're trying to overcome, I would jump it up to anywhere between 6 and 8 capsules a day. And then as that problem goes away, then you can go back on that maintenance dose of 2 or 2, 4, whatever. You know, it depends on your body weight and your own metabolism. We started out with an average person, average weight. We think they need 500 milligrams a day. But if you have an issue, just like I said, for instance, if you burn yourself, you got to burn. Jam it up. Take as many as you can take, 6, 8, 10 a day. And after a week, your burn will be healed. It's not the EMULIN that healed you. It's your own immune system. We accept right now broken bones to take 3 months to heal, sprains 6 weeks, colds to last 2 and 3 weeks. This is like we've accepted this as normal. This is not normal. If you have EMULIN in your diet, like you should, you're eating properly, and you break a bone, it's going to heal in 6 weeks. Your sprains are going to go away. Burns will heal themselves. They will heal themselves in just a week. I wish I was astute enough how to share my screen here. If I could do that, I'd show you a couple of pictures. It says share. I don't know if that's the one I need to do or not. Share. So does anybody see my screen right now? What does it look like? Is it just me?
Just you.
Okay, so I must not know what I'm doing. I thought it said basic advanced files. Well, I'm not going to do that then. I wanted to show a couple of pictures, and I don't actually know where the button is to share my screen. But I will tell you that people that had severe burns, they take the product, and in a week, it's completely gone. It's like a miracle. No, it's not a miracle. This is what your body does normally and should do normally. So if you have anything unusual that's not considered normal, aches and pains, arthritis, asthma, celiac, on and on, broken bone, double up, triple up on the EMULIN. And when that's healed, go back to your maintenance level.
Joe, I have found that during the summer, a lot of people are out getting sunburned. I just have them double up on that EMULIN, and the sunburn seems to just clear up really quick.
Well, that's really surprising, because if you're on a saturated dose of EMULIN, when you saturate yourself, it actually migrates to your skin, and you will find out that you won't get sunburned.
Yep.
It's interesting, David and Joe, when we were down in Vegas, I actually, had my EMULIN with me and ended up getting a sunburn, but no pain, and I didn't peel. And I was like bright red because I overindulged in the sun, being silly, and but no pain and no peeling, and I healed up very quickly. And I was like floored because I forgot to put on the sunscreen, Jana, and I did. Naughty girls.
Well, I want to clarify something, and Joe, you can cite in here. I was going to say that all these conditions, all these itises, are inflammation.
Yeah.
Right, Joe?
That's what itis means, inflammation.
Yep. And that's why the EMULIN works so effectively.
Awesome. I love this. So we have, about 8 or 10 minutes left. So I would like, there are some fantastic testimonies sitting here this evening. If you would please come on, and just in a minute or two, could you please share what EMULIN has done for you, and what it means to you for your life and for your families and friends? So who would like to go first? Vince?
I'll go, Jana. It's Eileen.
Great. Thank you, Eileen.
I've had such an incredible experience with EMULIN right from day one, back December 2016, within 4 days. But I think the key testimony that I share, and I share all the time, is the one with my son. He's 23 years old. He has autism, and he has had behavioral issues for many years. And we were able to get, Joe's screen is up now. He's been on EMULIN since January 2017, And it's absolutely phenomenal what it's done for him. But we didn't
Wow.
know that until we ran out. And when we ran out in February this year, and he was without for about 10 days, my son went sideways in his behavior, became very aggressive. He attacked one of his caregivers, and I'm still dealing with the outcome of that. And within 4 days of being back on the EMULIN, he was back. He was more settled and doing extremely well. And just recently, his caregivers were forgetting. They just got complacent and started forgetting to give it to him. And we started seeing that behavior come out again. And so I've gone and put it in his blister pack. So it is guaranteed that my son will not be without this medication or this supplement. It just, he needs it. He needs it more than anything else that he's on. And he knows he feels better when he has it in his system. And he is able now at 23 to tell us that.
That's amazing, Eileen. The testimony of Trainer is just so valuable to us. Thank you so much. Do we have someone else?
Yeah. As some of you know, I had a heart attack here 6 weeks ago. And when I left the island, I went to New Brunswick to St. John. They do most of the dye and the stents. I found out that I had one of my main arteries was blocked 100%, but they did a lot of blood work on me when I was over there. And they said they could not believe how good my kidneys were. Now, between Dave and Joe, you can probably have a better understanding than I did. But he said, what are you taking? Because he said, normally after you have diabetes for 20 years, which I have had, and then have a heart attack, there would be some lessening of at least one of the kidneys. And he said, both your kidneys are perfect. He said, including two of your other organs that they did the blood testing on. And I told him what I was taking. I said, I'm taking EMULIN, and it's go in and research Dr. Joe Ahrens. And he said, I will. He said, but I won't be able to do anything because I'm a doctor in Canada. And that basically tells you exactly where you come. But the last thing he said to me was, don't ever stop taking what you're taking.
Amazing. It has been such a help to you in so many ways, Brian.
Big time.
And I'm so grateful for that. Do we have another testimony someone would like to share?
I'll share.
Thanks. Thanks, Nanette.
You know, I've taken EMULIN religiously for 2.5 years, I think. And though I'm not one person that could say I had an outward, feeling of something different with the EMULIN, except for when I was working in Vancouver, getting up at 3 a.m. to drive in every day. I would hit a wall about 2:30, go figure, in the afternoon. And when I started taking EMULIN, I didn't hit that wall anymore. And that was huge for me. But my story it really is heartfelt in my little home, because my kids are gone now. They're married and raised, and I just have 2 little dogs, one of which is 14 and has a really bad cough now, but the other one is 7. She came with a problem 1.5 years ago with her. She had a degenerative thing happen in her back. Bones were rubbing against each other. She couldn't jump anymore. She couldn't, and she was like a cat. She'd be up on the back of the couch and jump up on my bed, which is even higher than the couch. So the vet said it would be a $15,000 to $30,000 surgery and recovery time. And that kind of wasn't in the budget. So I decided to start giving her EMULIN. And, you would never know that dog had any challenges. She can run and catch squirrels and mice in the backyard, believe it or not. She can jump as high as she did previously and is extremely healthy. And I'm very thankful, because she's a sweet little thing and she should live another 7 or more years. So I'm very happy for Sophie. And I would encourage anybody, because Dr. Joe's asked me a few times, how much do you give her? Well, she's on Emulan M, and she has been from the beginning. And I just shake a little bit in her food once a day. That's all I do. So one capsule lasts a few days, but now I'm giving it to both of them, so it doesn't last as long as it used to. But it's certainly been a huge blessing for my little pets. So I would encourage anybody to use it for that as well.
That's amazing. And Eileen has
Hey,
just
hey, Jana.
Yes.
This is Dave. I want to tie in to what Nanette said. We have a golden retriever, 6-year-old, and golden retrievers have been known to have some hip issues. Well, our poor Ginger's had some hip issues, and I give her 3 EMULIN, and the hip seems to get better. It's amazing. It's she starts bouncing around and running around after a few hours of being on EMULIN.
There was a post the other day about a older dog that was having some hip issues, and they gave him a couple EMULIN, and they've got the video of him walking before and walking after, and it's like a different dog.
Oh, I know. It's great. It's great to see them. They love it.
That's amazing, because of course they're really smart, and if they took EMULIN, they would never get off it, but they can't ask for it. So
Right.
I'm so glad you're great pet owners. That is the best. So let's have one more, and then we'll wrap it up for this evening. And I so appreciate that all of you are participating here. Thank you.
Hey, Jana, it's Ron.
Thank you, Ron.
Both Donna and I have had a rotator cuff injury, and those are quite nasty, and they seem to last a long, long time. And within literally a week of being on EMULIN, we both wound up having complete freedom of no pain whatsoever. And tagging into, and we're both doing a lot of physical labor lately out in the yard and that kind of thing. And I've had a low back injury from when I was a young man of 21. I fell down some stairs with my infant daughter in my arms, hurt my low back, went through long time therapy for that. And it would always raise its little ugly head when I overexerted. That doesn't happen anymore. And what both Dave and Joe were talking about, the inflammation, the redness that occurs either on the outside that we can see through a sunburn, or if it's the sugar doing damage within the artery walls. If we look at our skin, and I'm looking at everybody's skin when I'm talking to all of you, and we all glow. Those of us that have been on EMULIN for a while, we glow. And if that's happening on the outside,
that's right.
Put that in your brain to think about what it is on the inside of your body that you can't see or feel. It's changing your body dramatically. You don't even know it, what it's preventing. We don't know, we can't tell, but boy, I'll tell you, it's something I will never be without.
Thank you, Ron. I think we all feel that way, and that's why I appreciate all of you so much, because you are just warriors and champions of EMULIN. And we know how much it has done for thousands and thousands of people now. So I'm excited to get some campaigns going. We're hopefully going to have one going, maybe a 60-day run starting November 1. I've got that in the works. And I'm talking to some of the leaders about it, and they're very excited about it. And then I'm also thinking about one for the new year so that we can take Q1 into like record numbers with EMULIN. So thank you so much, Dr. Ahrens and Dr. Nelson, for being a part of this tonight, and especially
thanks, Jana.
Thank you to all of you for participating, because this is what it takes. It really takes a village, and we are a little village, and I think we're really going to do some great things here. And I'm excited for your future, and I just want everyone to win in this and be healthy and happy, and just, do so many things good for the world. So I love you all. Have a great week, and we'll talk to you soon. Bye-bye for now.
Bye.
Bye-bye.
Good night, all.
Thanks.
Good night.
Good night. Thank you, everyone.